presentation is designed for patients of the Victorian Colorectal Clinic who are booked to undergo colonoscopy. It's designed to help you with the preparation for and recovery after your colonoscopy. It does not discuss the decision to undergo colonoscopy, and that discussion is the subject of another presentation that can be found on our patient information page. If you are in any doubt about the need or otherwise for colonoscopy, make sure that you book an appointment to see me in consultation prior to the day of your scope. Your booking for colonoscopy can occur by one of two means. Many patients are referred for a preliminary consultation in the office, and at that time we can assess you completely, examine you as required, and discuss the procedure face to face. Other patients will be booked by what's referred to as an open access system, where the discussion about the colonoscopy occurs between yourself and your general practitioner or referring doctor, and I only see you on the day of the colonoscopy itself for a discussion of the scope, but not for a full consultation at that time. We'll still meet and talk prior to the procedure, and I will answer any of your questions. Some patients prefer to simply book in for the scope, while others prefer the option of discussing the procedure in consultation first. Certainly, if you have any significant medical issues, or if you're in doubt about your decision, you should organise a consultation with me well in advance of the scope. Regardless of whether you see me in consultation or are booked directly by your GP, all the relevant paperwork for your procedure and your admission will be sent to you by my office, usually by email. So it's important to make sure that you provide us with a private email address for receiving instructions and information. Make sure that you have this organised well in advance of the colonoscopy and that you've read the instructions carefully. Some of these paperwork instructions will relate to your admission to Cabrini Hospital, either at Malvern or Brighton, and it's important for your own safety that all of the details of this paperwork are filled out accurately and carefully and returned to the hospital as soon as possible, either in hard copy or by online registration. In addition, you'll receive detailed written instructions about how to prepare your bowel for the colonoscopy. I'll be discussing some of the techniques of preparation today, but you'll still need to read all of these notes carefully. The better you prepare your colon for the procedure, the more accurate the investigation is likely to be, so pay careful attention to the instructions. In particular, you need to let our office know well in advance if you're taking any blood thinners such as aspirin, warfarin or Plavix, or if you have a significant heart condition, or if you're diabetic, as special precautions may be required under those circumstances. Some patients have also been instructed by their cardiologists to take antibiotics prior to any invasive procedure or dental work, sometimes due to a structural abnormality in their heart. So again, it's important that you let us know this well in advance. It's also important to inform us of any allergies or adverse drug reactions that you may have suffered in the past. We have two options for bowel preparation. If you've undergone colonoscopy at this clinic before, then you'll probably have used Prep Kit C. But we're now also using a second type of bowel prep called Plenvu. You can discuss with our staff which of these preps is best for you. This presentation is for patients taking Plenvu prep. Preparation for your colonoscopy takes approximately 2 days, and it's vital that you follow these instructions carefully to make sure your bowel is adequately prepared. If it's not adequately prepared, we're less likely to get an accurate result from the colonoscopy, and in some cases the procedure itself needs to be repeated if good views can't be obtained. Whilst the effectiveness of preparation varies from patient to patient, you'll give yourself the very best chance of having an adequate examination if you follow these instructions carefully. When you first receive your paperwork, read through the preparation instructions and make sure that you purchase the solution for bowel preparation well in advance. Virtually every pharmacy will keep this in stock. Importantly, when you do buy the Prep Kit C or Plenvu or equivalent, there is generally an instruction sheet that comes with it. I'd like you to read the general information on these sheets, but then ignore the prep instructions on those sheets and follow our instructions directly instead. In relation to your diet, you need to alter your food intake 2 days before the procedure and reduce the amount of fibre and roughage that you take in. Details of this are contained within our written instructions, but it's important to stop eating meat, seeds, nuts, cereal, rice, fruit and vegetables, or any fibre supplements. You should replace this with boiled or poached eggs, white meat or fish, well-cooked peeled pumpkin or potato and plain white bread. you may drink skim milk products. On the day before the procedure, you can continue this diet up to and including a light breakfast. After that time, you should henceforth take only clear fluids, in other words, with no solid food or milk products. These clear fluids may include, for example, water, sugar-free jelly, Lucozade, Gatorade, cordial, black tea or coffee, clear soup or broth, or Bonox. The bowel preparation itself and drinking of the Plenvu solution generally commences at about 5 p.m. and it's important that you follow the instructions carefully with the consumption of these sachets. The first dose of Plenvu should be taken at 5 p.m. Open the dose 1 sachet of Plenvu, mix it with 500 ml of room temperature water and stir it until the powder is completely dissolved, and this may take up to 8 minutes. Then drink the solution slowly over approximately 30 minutes, aiming at a glass of solution every 15 minutes. It's important that you ensure that you drink another 500 ml of water or clear fluids during this time. If you do feel like vomiting or have severe abdominal pain or nausea, try slowing down for approximately half an hour. But if this persists, you may need to call my office or attend casualty at Cabrini Hospital. It's often easier to take the Plenvu drunk through a straw so it bypasses the taste buds on the front of your tongue. Secondly, at least 1 hour after you start drinking dose 1, you should take the dose 2 sachet in exactly the same way as the first dose. Again, maintain an adequate intake of water, approximately 500 ml, in addition to the Plenvu. The preparation clears your bowel by causing watery and dilute bowel actions, sometimes over several hours. How long it takes for the bowel preparation to wash out the colon varies from person to person, or even from scope to scope, so be prepared for this. So it's much better to be preparing at home than to travel the night before the scope. If you've undergone colonoscopy and found that it took a long time for the prep to work, you're welcome to commence the bowel prep at 3 p.m. the day before the scope. Take the second and third doses at 4 and 5 p.m. respectively, if that suits you better. It is important that you should take your usual medications with a sip of water, both on the evening of the preparation as required and again on the morning of the procedure itself, unless you're diabetic, under which circumstances we'll have made special arrangements for you. You'll be given clear and detailed instructions by our office in relation to the time that you need to turn up to the hospital. Again, make sure that you're not relying on driving yourself home or taking a taxi or limo home unsupervised. If you're arriving at Cabrini Malvern, come in through the main hospital entrance and proceed to the day of surgery admission area. If you're unsure where to proceed, then please ask at one of the hospital's information desks. After you arrive and are checked in, you'll be admitted by one of the nursing staff in the day procedure centre. Ask to change out of your street clothes, and then there's generally a short wait prior to you being taken into the endoscopy suite. Prior to this time, you'll meet your anaesthetist, who will take a detailed history from you. You'll have an opportunity to ask me any questions prior to the scope starting. We can never be certain how long each procedure will take, so occasionally there will be a delay before your procedure commences. It's worth bringing along either a book, an iPad, or some reading material, just in case you are delayed. After you're brought into the endoscopy suite, a drip will be inserted either into your forearm or the back of your hand. You'll generally fall asleep pretty quickly after the injection of your anaesthetic agent, and most people will wake up in the recovery area with no memory at all of the procedure having occurred. Generally, I'll speak to you in the recovery area and outline the findings at the time of the examination. Because of the anaesthetic agent that you've been administered, some patients won't remember this discussion, so you will always be forwarded a copy of your report within 1 to 2 working days of the scope. The report you receive will have detailed information about the findings on the day, but also recommendations for the future, including a management plan for your current problem and guidelines about whether or not further colonoscopies or consultations are required in the future. For some patients, screening advice for the future will include the use of fecal occult blood testing. If a polyp is removed or some form of biopsy is taken at the colonoscopy, this will be indicated on the operation report, with clear instructions for you to ring approximately 3 to 5 working days after the procedure to confirm the results of the biopsies. At any stage, if you're in doubt about the path forward after your colonoscopy, you should return to see me in consultation. After you head home, it's normal to feel that evening tired, perhaps have a sense of bloating, and low-grade abdominal discomfort. If at any stage these symptoms become severe, please contact me directly. You should not drive or consume alcohol until the following day after the procedure. After the procedure, if a polyp's removed, there's a small chance of you developing bleeding. A small amount of blood loss after a colonoscopy is normal, but if the blood loss is profuse or you are at all concerned, you should contact me directly. If another procedure has been arranged and performed at the same time as your colonoscopy, you'll receive separate instructions in relation to recovery from this. For many patients, it will be appropriate for you to undergo regular colonoscopies in the future, and details of this will be outlined in your operation report. We have a computer-based recall system that assists us with the process of contacting you when your next colonoscopy is required, if appropriate. This is, of course, a computer-based system, so if you do have a change in your circumstances, shift to another address, change your personal details, including your email or mobile number, you should let our office know directly. We've tried to be as comprehensive as possible in our instructions for you, but again, if you're in any doubt or have concerns, please contact our office directly.